You're listening to the Pharmacy Podcast Network.
If you or your patients struggle with muscle cramps, spasms, soreness, or restless leg syndrome, you're going to want to hear about our non-opioid TheraWorks Relief. TheraWorks Relief is a clinically proven and published locally acting topical solution that prevents and relieves muscle cramps, spasms, and soreness in the legs and feet. In a research study including patients diagnosed with restless leg syndrome, TheraWorks Relief was shown to reduce symptoms commonly associated with accompanying RLS, including muscle cramps and spasms. Muscle cramps are reported as a side effect of hundreds of prescription medications, from intravenous iron sucrose and conjugated estrogens to statins and diuretics. By managing muscle cramps, TheraWorks Relief supports adherence, helping patients stay on important and often life-saving medications. TheraWorks Relief comes in an easy-to-use, fast-absorbing, non-greasy foam that can prevent muscle cramps and spasms with just a few simple applications a day. To learn more about TheraWorks Relief, go to theraworksrelief.com and click on the Healthcare Professional link.
You are listening to the PGX for Pharmacists podcast, part of the Pharmacy Podcast Network. Pharmacogenomics is the study of how genes affect a person's response to drugs. This revolutionary science combines pharmacology and genomics to develop effective, safe medications and doses that will be tailored to a person's genetic makeup. There's no better healthcare provider positioned to leverage the analytical power of pharmacogenomics to provide more effective medication therapies and outcomes than a clinical pharmacist. And now, here's the host of the PGX for Pharmacists podcast, pharmacist, researcher, and national pharmacogenetics expert, Ken Sternfeld.
Good afternoon, Pharmacy Podcast listeners. My name is Ken Sternfeld, and this is PGX4 Pharmacists. We are changing the DNA of the pharmacy profession. Today, I am excited to have a wonderful friend from NeedyMeds, CARLA DELLAPORTA, on as our guest. CARLA is the Director of Education and Partnerships at NeedyMeds. Her professional background has been entirely dedicated to nonprofit organizations from New York City all the way up to Cape Ann. In her role at NeedyMeds, she focuses on educating people about NeedyMeds and the healthcare cost-saving resources they offer, and expanding partnership efforts with other nonprofits to help the broadest population of people. Welcome, CARLA, to PGX for Pharmacists.
Thank you so much. I'm very happy to be here, and I appreciate the warm welcome.
Well, we want to start by telling about our listeners about the warm welcome that you gave me several years ago. When I started my journey as a concierge pharmacist, I was looking for not a topic, but a culture about what I could support. And it was about saving money on prescription medications. So I did some research, and this is, 3-4 years ago when I started my journey as a concierge pharmacist, and I found NeedyMeds. And at that time, you were, 16, 17 years into your journey of saving hundreds and hundreds of thousands and ultimately millions of dollars for people who are in the healthcare industry patients who can't afford their medication. So why don't you tell us a little bit about NeedyMeds, CARLA, so our listeners can tell us what NeedyMeds offers to the patients.
Thank you so much for the opportunity to explain that, and we appreciate not only being included in today's podcast, but welcoming Ken on board as a member of the NeedyMeds team, since our missions so clearly align. And that's evidenced by our updated mission statement, which is that NeedyMeds is a national nonprofit dedicated to educating and empowering those seeking affordable health care. Essentially, NeedyMeds connects people to programs that will help them afford or save on their health care expenses. And we do that through our website, needymeds.org, and through our toll-free helpline, which is 1-800-503-6897.
Wow. So when I was looking for ways to help patients and I came across NeedyMeds, you really were the backbone of what we were doing, which is saving money on prescription medications. This month you have a very exciting initiative going on. It's an extension of a 30-year legacy program that you've been doing with an organization. Can you tell us a little bit about that organization and how NeedyMeds supports it?
Sure, I'd be happy to. And as Ken said, we do have an exciting initiative going on this month. To get started, let me tell you a little bit about NCPI. NCPI, that's an abbreviation for the National Council on Patient Information Education, was an organization that was established back in 1982. They're a nonprofit whose mission is to stimulate and improve communication about the appropriate use of medicines between healthcare professionals and their consumers. Towards the beginning of this year, NCPI handed off its educational resources to NeedyMeds, including their primary website, bmedwise.org.
Can you tell us a little bit about what bmedwise is? Because I went to the website and it's very, very informative and educational.
Great, thank you. And one of the calls to action during this podcast is that our listeners will do exactly that they'll take the time to visit NeedyMeds.org to get a sense of the robust healthcare cost savings we offer, and also to visit bmedwise.org. bMedWise's primary goal is simply to promote the safe use of medicines. Now, it will be chock full of information. On their website, you can find more details about the safe and appropriate use of medicines, the safe storage of medicines, and the safe disposal of unused medicines. So we do hope that you check that out.
I found it to be very helpful as a pharmacist because we're always asked these questions at the retail environment. We're asked them, even friends and family say, how do I get rid of my medication, or what do I do? So this is really a resource that every pharmacist, every pharmacy student should look at and kind of tuck it away in their favorite list of places to go for information. So within that site, I saw that there were actually promotions and conversations and topics that they came up with. This year's topic was very, very interesting. Can you share that, a new topic, with our listeners today?
Oh, yeah, this is really exciting. What Ken is referring to was back in October 1985, NCPI sponsored what's called the first Talk About Your Medicines Month. So every October, they come up with a new program as part of bMedWise, which offers an annual opportunity to focus attention on improving medicine communication, which, as healthcare professionals, our listeners probably know, better medication communication can result in better medicine use and better health outcomes. So for 33 years, this is its 33 years, NCPI has sponsored Talk About Your Medicines Month. And over the course of these more than three decades, Talk About Your Medicines Month has really expanded to stimulate conversations between consumers and their healthcare providers about all the types of medicines they may take. And it focuses on important details like what to know about a medication in terms of expected health outcomes, what are the possible side effects, what are the benefits you should expect, and also importantly, what are the potential risks. Now, each year, it's really robust, and each year a theme is chosen. For example, previous year's themes included Think Before You Drink, the safe use, safe storage, and safe disposal, Be Medicine Smart, and you can find all of those themes, because they're still relevant, on each of those previous years on the Talk About Your Medicines Month page of the bMedWise website. So that's what we focused on in previous years.
What's happening this year?
So this year, and any opportunity I get to talk about this, I welcome, because this month, the Talk About Your Medicines Month theme is taking action to prevent opioid misuse and abuse. So as our listeners well know, opioids, such as methadone, oxycodone, are a class of drugs used to reduce pain. And according to the CDC, opioids, both prescription and illicit, are the main driver of drug overdose deaths. Some of the statistics are really frightening. In fact, each day, it's estimated that more than 1,000 people are treated in emergency departments for not using opioid prescriptions as directed. And an average of 115 Americans die every day from an opioid overdose. So because of these scary statistics, and the fact that America really has this new drug program that seems to be touching the lives of almost all its citizens. This year's Talk About Your Medicines Month theme is taking action to prevent opioid misuse and abuse. So the message to it really is, Ken.
So when you're talking about the opioid epidemic that's striking our country and killing people, to have a pharmacist involved and to find ways, taking that action to lower the risk and misuse and abuse of opioids, it really is very near to our professional heart. It's what we need to do as pharmacists. So I think the timing of this, the impact that a pharmacist can make by looking at these resources, gaining a little better perspective of what a pharmacist could do during National Pharmacist Month, I think is an extremely synergistic opportunity for a pharmacist to work with the people of NeedyMeds who are supporting this cause.
I couldn't agree with you more. And not only is it close to your heart and your profession, but really pharmacists are such a crucial part of the healthcare team. So our message to listeners is really, and it's really a call to action, which is to empower yourself further through education by visiting the talkaboutyourmedicines.org, a website that was created specifically to provide life-savings resources for opioid safety. And we understand that sometimes as a pharmacist, you may not be able to have as long as a conversation you'd like with each of your patients. So the important thing is you have a reputable site to refer them to. And again, that website that was specifically created to take action to prevent opioid misuse and abuse is talkaboutyourmedicines.org. And this website offers detailed information like what in fact are opioids, what drugs are in this category. And as a pharmacist or pharmacy student, you may well know that. But lay people such as myself, we really don't know what exactly falls into that category. The website will also offer information on how to actually take action to prevent opioid abuse and misuse. It'll give people suggestions on how to guide their conversation with their healthcare providers so that they can make the most informed decision with their doctor. There's also a lot of information on safe disposal, which is an important part of addressing opioid abuse. And there's even resources for counseling patients with new opioid prescriptions. So we encourage everybody to visit this site, refer people there, download the information to hand out to your patients, and share, because really it could save a life.
For sure, saving a life not only for opioid addiction, it also ties in perfectly with an RxVIP. This is PGX for pharmacists and our commitment to lower the risks of adverse drug reactions for opioids and all other drugs, because the numbers for loss of life with adverse drug reactions are twice as large as just opioids alone. So when a pharmacist can help, sometimes you're at work and you say, well, gee, I hear about all these problems, but what can I do? Well, if you can do one thing with one patient to advise them of the resources on the website or counsel them in some way, shape, or form as a healthcare professional, you've made a difference in someone's life. And that's what we went to school for. So the RxVIP concierge concept is really not about dispensing the medication. It's about dispensing the care, the compassion, the empathy, and the knowledge that we can find ways to help patients if we take the time and make the time. So from day one with NeedyMeds, I realized that they were a backbone to RxVIP concierge. We love to support their efforts. We love to be advocates. And every student who comes into our rotations are given the opportunity to learn more about NeedyMeds so that they can take it with them in every aspect of their career path after they leave us. So the message that you give, Carla, and your company and everyone who supports it is really so resonating to us as pharmacists, and specifically as concierge pharmacists. So give us that website again and tell us about NeedyMeds, some of the ways to follow you and to, social media is foreign to me, but, give everyone, websites and Twitter handles and all the other things so they can stay connected with you.
I'd be happy to. And as you can hear when Ken so enthusiastically speaks about RxVP, that enthusiasm is extended to the partnership with NeedyMeds because, as I had said in the beginning, our missions clearly do align. And at NeedyMeds, not only do we take seriously keeping our resources up to date, but we adhere to the philosophy that all of the resources we offer are not only free, but they are anonymous. So what that means is when you call our toll-free helpline, and that number again is 1-800-503-6897, or when you visit our website, which is NeedyMeds.org, you don't have to give any identifying information about yourself. We're not going to ask you to log into the website. We're not going to ask you for identifying information over the phone. Our goal is to get you the information free, anonymously, and without any obstacles to you being able to obtain those. And so Ken had given me the opportunity to do some plugs about other ways you can stay in touch with NeedyMeds. So certainly, again, the website is NeedyMeds.org. But we also encourage you, in light of Talk About Your Medicines Month, to visit the website we've created specifically to this month's focus, which is taking action to prevent opioid misuse and abuse. And that website is simply talkaboutyourmedicines.org. Of course, you can find NeedyMeds on Twitter and Facebook. And on the top right hand of our homepage, you'll find a whole bunch of social media icons. One of the ones I want to plug is the NeedyMeds YouTube channel. You can find that icon there, or you can simply search for NeedyMeds in YouTube, and you'll see a whole catalog of previously recorded webinars. And you might find some topics that will be helpful to you in your profession, or just some webinars you'd like to share with your patients.
That's wonderful. And I've been instructed by my new boss, Todd, because the Pharmacy Podcast Network has recently acquired RxVIP Enterprises and Concierge, and we're thrilled to be part of Todd's family going forward so we can advance our message and other messages across the pharmacy continuum. But Todd makes me always say at PGX4RX, our Twitter handle, or at Pharmacy Podcast. So whatever we're doing together as a profession and doing it with NeedyMeds and making NeedyMeds an important, for me as RxVIP, I've always been a supporter. I've always wanted them to, I will sponsor and work with them on any of their initiatives because I think they're angels. When you can save over $2 million in healthcare costs for people who need it, and there's nothing about them but except being a wonderful nonprofit organization who's doing this. The president, Dr. Richard Segal, is a medical professional, has been doing this for over 20 years. So after 20 years, give him $20. By the way, this isn't public television or public podcasting, but if you feel, as I do, that these things are so important, give a little because they give a lot. So we were recording this podcast, Carla, I don't know whether you know it, at the same day that at the White House today on October 10th, they're signing a bill that was passed by Congress known as the Know the Lowest Price Act of 2018 and a second bill called Patients' Rights to No Prices Act. You and I were talking about this article that we shared together where now the Congress and our government has stopped the gag rule that pharmacists were under, not to tell patients the truth at the counter that perhaps they could get a medication lower by paying out of pocket than through their normal insurance. I personally felt gagged to the point of almost I was sick to my stomach when I was prohibited from telling a patient that I could save them money, but I wasn't allowed because the PBM that I was working for, or the industry that had a business focus of making money and not helping patients, stopped the pharmacist from helping patients. Well, that law is going into effect today. And the fact that we're doing a podcast with you, Carla, and you and I have been talking about this in ways that just makes me very, very, very happy to have you here as a guest and to have you part of the RxVIP and now Pharmacy Podcast Network family. We're going to look to do lots of podcasts. We're going to turn NeedyMeds into a podcasting machine to deliver messages, if you will let us. So
absolutely.
Thank you.
Thank you so much for having us as a guest. And to our listeners, I'm sure you have a countless number of options to what you're choosing to listen to. So thank you so much for taking time out of your day to hear a little bit about what we have to offer. And we do hope that you find it helpful. Thanks so much.
Thank you, Carla. You have a wonderful day. This is Ken Sternfeld for PGX for Pharmacists. We are, with the help of our guests like Carla from NeedyMeds, changing the DNA of the healthcare by helping patients as their advocates. So remember, ask your pharmacist about PGX testing, and everybody have a wonderful day.